Good afternoon, everybody. Thank you so much for joining today's webinar on tips to keep safe in the workplace during COVID-19, which forms part of our COVID-19 comms for this week. My name's Mel. I'm the Quality and Process Audit Manager here at Care First. Just a few caveats before we begin. It's important to highlight with the content that we're covering that all industries and organisations will differ in their risk assessments and health and safety requirements as outlined by the government. So it's important to familiarise yourselves with what the guidelines are with your own workplace, and if you have any worries at all, don't hesitate to speak to your HR department or your line manager. Also, just to cover as well that the information sourced for this session was accessed last week, so all information is accurate as of those dates, but it may be subject to change obviously after today, as the situation progresses. Just notify you all as well as that everybody attending today's session is in listen only mode, so if you do have any questions at all throughout the session, please do feel free to type those in the questions box on your right hand panel of your screen, and we'll be able to do a live Q&A with myself at the end, and I will answer those as best as we can. Okay, so with many organisations that are still not open for business, or those which are continuing to operate remotely during the pandemic, businesses might be beginning to look at what a return to work might look like for their employees, and just consider really what measures that they may have to implement just to ensure the safety of their staff. Equally, it's really important that we highlight that all businesses, buildings and facilities are different, as I said right at the beginning. Some are already back to work, and some have worked obviously throughout the pandemic. And the new COVID-19 secure guidelines are available to all UK employees, to help them get their businesses back up and running and workplaces operating as safely as possible. And that follows the Prime Minister setting out steps to beat the virus and restart our economy, just so that we can protect jobs, restore people's livelihoods and fund the country's vital public services. The government has prepared guidance to develop the best practice on the safest ways of working, which we will cover throughout this session across the economy, providing people with confidence that they need to be able to return to work. So today's session, we're going to cover off a few areas. So we're going to look at what those 5 steps to working safely are that the government have outlined for employees. We're also going to look for practical tips for returning to the workplace, and also PPE guidance, so what that considers for face masks and gloves, also communication, and our information sources for this session we will be sharing with you if you wanted to get some more information, and I'll also be sharing some information with you about the Care First service and how you access that all important support from us as well. So just to move into the 5 steps to work safely then, that are the government prepared guidance to be able to develop the safer ways of working and best practice across the economy. So they've set out these practical steps for businesses focused on these key 5 points, which is advised should be implemented as soon as it is practical. So as soon as we are given the green light to be able to lift lockdown further, and if your organisation is able to return to its working place, these are the 5 areas that your employer and businesses should be following. So the first being carrying out a COVID-19 risk assessment. Second being develop cleaning, hand washing and hygiene procedures. Number 3 is to help people work from home where possible. And number 4 is maintaining 2 metre social distancing wherever that is possible. And 5, where people cannot be those 2 metres apart, make sure that they are managing the transmission risk for the infection where possible. So those are the government guidelines for those 5 steps to working safely, which is advised should be implemented as soon as it is practical to be able to. Now we're just going to move on to some practical tips for returning to the workplace, and these are everyday things that you may want to consider. So whilst your organisation will be working really hard to ensure the safety of their staff, you might be feeling a little bit anxious about what a return to the workplace really might mean for you. And it's important to recognise really that and reassure ourselves that we can't know all the facts right now, but what we can do is anticipate that things may not necessarily go back to exactly how they were before. So we need to try and find ways to prepare ourselves for those changes and whatever they may look like. And below and on this slide here are some practical things that you may wish to consider when you return to work. So I need to highlight here as well that these points are just tips. They're not necessarily rules or guidelines by the government. These are just tips for you to consider on your return to work, whenever that may be. So the first one here being avoiding using public transport to commute to work wherever that's possible. So if you're able to perhaps walk or cycle to work, that might be something that you want to consider. Or if you have got the opportunity to drive to work, then that may be something you want to consider as well, to avoid going on those public transport facilities where you're going to be mixing with people that aren't from your household. Second one being keeping 2 meters apart from colleagues, customers and your clients. So try and apply that in all circumstances wherever that is possible. Keeping desks, workstations and work areas clear. So your organisation may be implementing deeper or more frequent cleaning regimes to your work areas. So it's important that you make sure that those areas are completely cleared to be able to allow for those kind of deep cleaning and more frequent cleaning that they may be required to do. Try and avoid in-person meetings wherever that is possible. You might have been holding virtual meetings during lockdown, and if you've been working from home, and you might have seen the benefits of using video or conference calls whilst you've been remote working. And you know, it might be that you want to continue to do that and continue to set that up. The government advice on this is that it's only absolutely necessary participants should attend in-person meetings, and if those meetings are in person, that they should always maintain the 2 meter separation, social distancing throughout that meeting. So try and keep that in mind if you do need to resort to having in-person meetings on your return to work. Lunch breaks. So you might find upon your return to work that communal areas that you used to access or areas that you used to have your lunch in, they may not be as accessible in the way that they were before. So you might want to consider taking lunch with you to work to avoid any unnecessary travel on your break. If you normally pop to the supermarket or a local deli on your break, you might want to avoid having to make that extra trip and avoid that interaction on your lunch break. So you might choose to either eat at your desk, which may not be ideal for many people, but equally if you have an outside space where you're able to socially distance to get some time away from your screen or your desk, then that would be an option for you to perhaps consider. Equally, if you are finding that you're having to take your lunch from your desk, we would always advise just turning off your screen during that time. Don't be tempted to just be having a working lunch. Make sure you are giving yourself a proper break and a screen break as well. Ventilation. So if you have a window or a door in your workspace, try and keep it open frequently just to encourage any natural ventilation where possible. So getting that fresh air into your office space is always going to be key. Taking your own hand sanitizer and antibacterial soaps to work with you. So most organisations may be required to provide this for their staff, but you may want to, just for peace of mind, for your own peace of mind, you might want to keep your own bottles with you just to avoid mixed use, and also just to allow you to use them when travelling to and from work. So just keeping a small bottle of antibac hand sanitizer in your bag, it means that if you are having to resort to using public transport or anything at all, that surfaces that you have to touch that you're concerned about when leaving your workspace, you have something on you that you can use and you're not reliant on the things that are supplied through your work. Also keeping some antibacterial wipes nearby. So if in your work area, it might be useful if you're passed anything by another colleague. For instance, if you're passed stationery or equipment, you might just want to give that a quick wipe down before you then touch it yourself. So it's always handy just to keep some antibacterial wipes nearby or on you if you can. Using your own stationery as well. So, some organisations may provide your stationery for you. It might be worthwhile keeping stationery at your workspace and just ensuring that you're not sharing that with your colleagues and it's not shared materials. You might want to make sure that you're taking your own and keeping that in your workspace so it's not shared. Also using your own water bottles, mugs, cutlery, that kind of thing. If you have those communal items usually provided, you might want to consider taking your own in from home into work just to avoid any potential cross-contamination, and ensuring that you obviously are washing those regularly in hot soapy water immediately after use or when you get home if you don't have those facilities at work. You may also want to consider washing your work clothes after use. So you might want to consider putting your work clothes that you've worn that day straight into the washing machine as you get home from work, just to avoid any cross-contamination from any fabrics, particularly if you are unable to socially distance in your line of work. That might be something more poignant to consider doing if you haven't being able to you know, keep to those social distancing guidelines. Another caveat on that is that you may also want to shower as soon as you get home, so you might want to consider that when you get home from work each day. As I said, particularly with your clothes as well, if there has been an instance where you haven't been able to effectively social distance at work, or you've had to come into closer contact with a client or a colleague, then you may want to consider just showering each day when you get home, just as a precaution, really, to make sure that there is nothing, you know, any cross-contamination anywhere at all. So we're also going to have a look at the latest PPE guidance as well, because there is a lot in the media that might be conflicting and maybe confusing. So hopefully this will help to just clear up some of the guidelines a little bit. So the current government guidelines advise that where you are already using PPE in your work activity to protect you against non-COVID-19 risks, you should continue to do so. When you're managing the risk of COVID-19, additional PPE beyond what you usually wear just isn't beneficial. And that's because COVID-19 is a different type of risk to the risk that you're normally facing in a workplace. And it needs to be managed through things like social distancing, hygiene, fixed teams or partnering, and not through the extra use of PPE. Obviously, that goes without saying. The exception with that is with clinical settings, like a hospital, or there's a small handful of other roles for which Public Health England advises its use of additional PPE where appropriate. So the advice is that workplaces shouldn't encourage the precautionary use of extra PPE to protect against COVID-19 outside of those clinical settings that we've mentioned, or when responding to a suspected or confirmed case of COVID-19. Unless you're in a situation, obviously, where the risk of COVID-19 transmission is really, really high, your organisation's risk assessment should reflect that the role of PPE in providing additional protection is extremely limited. So just to move on particularly then onto face masks, because we've seen a lot in the news and the media around face masks and how effective they are. And the guidance from the government is that there are some circumstances when wearing a face covering might be marginally beneficial as a precautionary measure. And the evidence is suggesting that wearing a face covering doesn't protect you, but it may protect others from getting it if you are infected but have not developed the symptoms yet. So a face covering can be really simple and maybe worn in enclosed spaces where social distancing isn't possible. So if it's not possible in your workspace or in a situation at work where you know you're not going to be able to guarantee that social distancing, you might want to consider wearing one. It just needs to cover your face by your mouth and your nose, by covering both of those areas. It's important to acknowledge, though, that face coverings, they're not a replacement for the other ways of managing risks, as we've outlined previously. So these measures, they do remain the best ways of managing risk in the workplace. And wearing a face covering is optional, is not required by law, including in the workplace, obviously with the exception of clinical settings. If you choose to wear one, it's important that you use face coverings properly and that you're washing your hands before putting them on and taking them off. That's really important. Towards the end of last week, there was an announcement in the media that face masks are going to be made compulsory on public transport in England from the 15th of June next week. So that's the latest government measure to be able to tackle the spread of COVID-19 and prevent a second wave. And that's applicable to trains, buses, tubes and ferries just in England right now. And what they've advised with that is that it stops people from spreading the virus more than it stops you from getting it. So as we've said, you know, it's not necessarily going to stop you from getting it, but it will stop the spread of it. It can be effective in doing that if you are wearing them or if you're asymptomatic. And Sadiq Khan, the Mayor of London, advised that the same really, it may not keep you safe, but it does stop you from passing on the virus if you're symptomatic or asymptomatic. So that's the point to consider with face masks, is it's not going to stop you from getting it, but it will help to stop the spread. Then looking into the use of gloves then, because there's also been a lot of correspondence in the media around this as well. So for the general public, CDC, which is the Centers for Disease Control and Prevention, they recommend wearing gloves when you are cleaning or if you're caring for somebody who is sick. But in most other situations, like running errands, so using a shopping trolley or using an ATM or using pin pads on to be able to pay for things using your card, they're advising that that wearing gloves isn't necessary. Gloves won't necessarily protect you from getting COVID-19, and it may still lead to the spread of germs if they're not used in the right way. So instead, they're advising that you practice those everyday preventative actions. So keeping your social distance at least 2 meters apart from others, washing your hands with soap and water for at least 20 seconds, or if that's not possible, using a hand sanitizer, and that hand sanitizer needs to have at least 60% alcohol content. And also, obviously, if the social distancing measures aren't possible, wearing that cloth face covering in enclosed spaces may be beneficial to help stop the spread. And then just a piece really around communication. As I mentioned right at the beginning of this session, it's really important to highlight that industries and organisations, they really will differ in their risk assessments and health and safety requirements as outlined by the government. If you have any questions or worries at all regarding, your safety at work or your team's safety at work, or you're worried about a return to the workplace following the pandemic, this should really be communicated with your line manager or your HR department, because they're the people that are going to be able to provide you with information that's applicable, directly to your organisation and your industry, and give you that reassurance of the measures that they're taking to keep you safe. So last, I just wanted to cover off on this content the information sources that's been used for this session. It has been taken by really reputable sources. Everything has been taken by .gov or the CDC website, and the information for this session was sourced as I said, by .gov or for the Centres for Disease Control and Prevention. All the information is accurate as of the date that it was accessed, which was the 3rd of June last week. And obviously we've included those updates with what's come about in the news for the new guidelines for face coverings in England. But it's important to highlight, that this is an ever developing situation, and it may be subject to change after this date as it progresses. So if you wanted to access the information in more detail at all, I've included these links here. If you would like a copy of the session slides following today's session, then please do email me following this. Excuse me, and I can arrange to have those sent out to you. But these are the links that you'll need to be able to access the content that we've gone through today, and obviously access that in a bit more detail as well. So I also wanted to cover off some information about Care First during the session as well, because if it's natural that with a change that may come to some of us, or that may already be happening for some of us in that being the return to work, and we might be feeling anxious about it, it's important that we know where we can go to be able to get some support. So hopefully you've all at least heard of Care First before. For those of you that haven't, this will act as a bit of a reminder of the key areas of our service and how we can support you. So we're a professional counselling, information and advice service. We offer support for absolutely any issue arising, whether it be from the workplace or from home. We recognise at the moment, obviously, that's one and the same for many people. And it's important that, we don't just say leave work at work, leave home at home, because it's not possible. And certainly in circumstances from remote working, it's even harder. So we're able to support with absolutely any issue that's causing you a stress, worry or anxiety. The service is available 24/7, so counsellors are available round the clock every single day of the week, 365 days of the year, to help support you with any issue. When you first call and speak with a counsellor, this isn't a kind of booking in service that you call to book to speak with a counsellor. You are speaking with the person that can help you straight away. And the counsellor will just assess really what the presenting circumstances are, and they'll just try and gauge a focus for the piece of work they're about to do with you. And they will ask you questions like, what is it that's prompted the call today? What is it that's made you phone? How is it that we can help right now? And they will just assess what that best way forward is going to be for you. And that might be that you only need to have that one-off conversation in the moment that day and have some in the moment support and talk through what it is that's prompted your call and give you some supportive things to go away and work on. Or they might suggest phoning back at the same time next week, or let's talk again whenever you might need some support. Or they might consider that you benefit from a more contracted level of support, and that's where you would speak with the same counsellor on a regular basis every week. And that would be to a set amount of sessions, and it would be a focused piece of work. So whatever it is that is clinically appropriate for you, they'll be able to assess that during that initial call. You also have access to information specialist services, which are available 8 AM to 8 PM Monday to Friday. And the reason why we find it so important to include that element of support within our services is it's not always the emotional things in people's lives that cause the most stress, worries and anxieties, but actually the practical things. Practical things right now, like what does a return to work mean for me? What practical things am I going to have to put in place? How will this affect my childcare? How will this affect elder care issues or benefits or anything at all like that? You might have questions around housing or tenancy issues, they're able to support with a huge range of issues. They're all ex-Citizens Advice Bureau staff. We do say you could just use Citizens Advice. It's an excellent service, but they are voluntary, so it can be quite difficult to get hold of people in certain specialisms. They're also money trained experts, so they're able to advise budgeting tools and calculations for you to help budget your finances as well throughout this period. So there's a huge range of support available through them. If there's anything that you think I'm not sure Care First can help with, please do pick up the phone anyway, because even if it's something that our services can't directly support, our teams are excellent at being able to signpost you to other areas or other organisations or charitable organisations that can support you with a particular area. So please do always consider picking up the phone and just asking first. And sometimes with some of the practical things, once we've gained the information we need, we feel much more in control of a situation again, and we feel much more able to cope with it, and that can help us in terms of coping with the emotional side of issues as well. So you also have access to the Care First lifestyle site through your service with Care First. It's an excellent hub of resources and information, and you can also access an online counselling facility through that website as well, where you can speak in real time with a counsellor to support you in the moment if you don't feel comfortable in picking up the phone, or if you're not able to have a telephone conversation, you can have some support online through that facility as well. If you're a manager or if you have any leadership responsibilities at all, you also have access to the Care First Management Support Service. And this is very different to counselling. This is support for managers on how to get the most out of their teams, how to deal with a difficult conversation, whether that be around an absence management or a disciplinary, or perhaps an employee has come to you and they're going through a bereavement at the moment. That can be a very difficult one to try and manage and also maintain your managerial boundaries with that. And managers can also find it difficult to approach their own manager about how to handle a situation, because they feel that as a manager they should already know how to handle that. So sometimes it's really good to be able to get that unbiased opinion and just be able to speak with our advisors on how best to handle a situation, and also they can help you in terms of how best you signpost somebody to our services to make sure that they get some support if they need it. So I also just wanted to talk about confidentiality. It's normal when a service is provided through work that you may question just how confidential it is. If you take anything away from today's session today, please know that the service is 100% confidential. Nothing that you say can ever identify you within your organisation as to having used the service, and no information is ever passed on to any third party at all. That is with these three really exceptional circumstances, as I'm sure you can appreciate, is the threat to life of another person, child protection and vulnerable adult issues, and the risk to the security of your organisation, and that can be the data or structural risks. So I hope you found today's session useful. Obviously, we've just covered some key tips around practical ideas to be able to help keep you safe in the workplace. We've also covered some of the government guidance as well as the CDC information as well. So I hope that you found that useful. If you have any questions at all following today's session, please email those through to info@care-first.co.uk. We are running daily webinars throughout the COVID-19 pandemic, so please do refer to the COVID-19 calendar that your organisation will have shared with you. If you want to access any of the Care First services, you can do so by calling the free phone number. Unfortunately, I can't include everybody's phone numbers here because they do differ between organisations, but if you don't have a copy of the number to hand that you need to access the service, you can obtain that from your line manager or from your HR department. So if you have any questions at all, please do feel free to send those through to me after the session at info@care-first.co.uk. Thank you so much for joining today.